Okay.
And just one more thing, Felicia, I see in the chat that people would prefer if we could put the slides in presenter mode,
Yes.
presentation mode, pardon me, not presenter mode.
Okay, working on it now.
All right.
There we go. While we are waiting for those slides to come up, we have an icebreaker, and with the technical difficulties that we're having this morning, which we appreciate your patience with, we're going to switch things up just a little bit. While we're waiting to get those pulled up, we're going to pull up a map here in just a second. And the plan was to have you guys show us where you're from, and so have everyone introduce themselves, but we have a lot of you guys this morning. And it's still important that we hear where you're from, who you're with. So instead of having us do that individually, if you will put that in the chat box for us, if you will put the name, your title, your agency, what county you are with, something interesting, but we are going to put that in the chat. And so while we're bringing that up, you guys can go ahead to start to do that.
And then on this end, we'd like to have you verbally tell us who you are and where you're from and county you're serving.
I am Barbara Both, and from Hendersonville, and we serve Henderson County as well as the surrounding counties, office-based opioid treatment. I want to say.
Thank you so much and welcome.
Hello, my name is Matt Brown. I'm a clinician in group practice in Chapel Hill, North Carolina.
And hey guys, I'm Nick. I'm the youth specialist for the Burke Substance Abuse Network out in Burke County, Western North Carolina.
Hey, welcome to our section. What are some of the responses there, Amanda?
So we have Ashe County, Eastern North Carolina. We've got Jasmine from Duplin, David Powell from Robeson County, the Offender Resource Center. We have Erica with Rice. So well represented across the state. This is definitely the benefit of being able to gather together virtually and in person. And so thank you guys, those who are in person, for introducing yourself. Again, we had a map here. And so this just, as we see these names come in, and these counties and locations and agencies, we can see that we are very spread out across the state. And so we are glad that we're here today. I see they're still coming in. We have a large group this morning.
Yes, we do. And for those of you who are coming in just now, be sure to mute yourself and check your backgrounds, because you are appearing on the screen here for us. We have all of you here. All right, so let's get started. I'll pass it back over to Dr. Maxwell.
As with any great technology, I am having challenges with the slides. Give me 2 seconds, and then I'll pull the slides up. So if someone else wants to verbally introduce themselves in the next 30 seconds, that will definitely help us out this morning.
I want to give a little bit more background maybe on the COVID providers. We have 19 providers who are funded to provide COVID-19. Okay, sorry, take this off. You hear me a little bit better like this. We have 19 providers who were funded this past year, August 2nd, was the beginning of the funding, to provide COVID-19 services throughout various counties. So you will see and hear most of their responses. This is in regards to an assessment piece that they have to do. We're helping them to augment it by starting them off with this training. And so, you ready? Good. Pass it back over. We just went through our icebreaker with Amanda, but we want you to see the slides. They're pretty cool. Okay. And as I mentioned, we're funded for various counties throughout the state. more than 19. It's 19 providers, but I'm not sure about how many different counties. Some of them are actually providing services in multiple counties.
I think it was 25, Felicia, as I recall.
Cool. All right, so our objectives today are to focus on incorporating the social determinants of health and ACEs data, which is the adverse childhood experiences, into existing needs assessments that they've conducted already. So they're going to be incorporating this, and I challenge you all to look at your assessment material. Think about what you've done as far as collecting assessment data, and figure out, how you can incorporate this as well. We're going to explore how social determinants of health and ACEs data are linked to higher impacts on substance use disorders. Identify populations with increased impact, whether it's economic status, unemployment rates, things like that. Review the program selection process to determine if the chosen program is the best fit for that target population. Okay, we kind of did things, I always say this a little backwards. You're supposed to do that assessment, go through it, analyze the data, then look at, choose your program. But with this, we kind of didn't have a lot of time. So the programs are out there, but we want to use this to kind of confirm the choices that they've made. And then the last piece is to create an assessment plan to capture social determinants of health and adverse childhood experiences data. Okay, next slide. Throughout this whole training, for the next hour and a half, we will be using a form in which we will be able to email you all later. This is a form that they'll be using to make those reflections of the current data that they have and comparing to see whether or not they have the social determinant of health or ACEs data. And if not, where can they get it? So this is sort of like a notes taking form, and they'll be using it throughout the whole training.
Yes, and Felicia, I would like to add as well, as most of you all, I think I emailed the form to this morning. If you have individuals in your organization that will need access to the form, feel free to share that with them. But as Felicia stated, that the intent of this form that you see on the screen is that you can take notes, as we go through this training, that will hopefully guide you as to where you need to go to complete your augmented needs assessment work after today's training. All right, and so also just to ensure that we're interactive in today's workshop, we will be using Mentimeter to ask some questions. And so if you have your cell phones, or you can do this via a laptop or a tablet, if you go to menti.com and enter in the code 21560464, you will be able to respond to the questions on the slides once we get to them. If you don't capture the information right now, when we get to those particular slides, the reminder information will be on those slides as well. And so as Felicia stated before, the purpose of today is to provide you all with some foundational information to help you augment the original needs assessments that you completed as a part of your proposals. It is not intended to be a needs assessment 101 training. We're going to focus specifically on social determinants of health, as you see on your screen, as well as adverse childhood experiences. And so when we look at why are we considering social determinants of health, we all know that in 2020, we experienced something that all of us have never experienced before in our lifetime, which is the COVID-19 pandemic, hence the COVID-19 supplemental funding. And this pandemic was a major catalyst, a perfect storm, if we can say, that sort of forced us as a community, as a culture, to slow down long enough to see what many of us have experienced or have observed for decades, which is that many individuals, many communities have been disproportionately impacted by certain circumstances where there's education, economic, substance use, you name it. And oftentimes, and 2020 actually highlighted this for us, that many of the experiences that individuals have are usually the results of systemic issues. And so hence, we are working towards addressing those through the work of this project. And we are focusing in, on social determinants of health. And so to get us thinking about this a little bit more, here's our first question. If you will, if you've already logged into Mentimeter, or if you have not, if you can take the time to do so. I apologize. Can you all still hear me?
We can hear you, Angela. The screen is white though.
Yes, and it actually just disappeared. We love technology today. I'm going to stop the screen right quick.
That's okay. And for those asking, Jessica also put in the code for the Mentimeter. And so if you needed that, it is there in the chat, which as a reminder, if you have questions throughout the presentation today, we will be monitoring that for you. And so feel free to type in anything that comes to mind that you would like to ask, and they will address that.
So let's do this right quick. If we can open it up for discussion, because the PowerPoint literally disappeared on me. So I'm going to have to pull it up again. Whenever you think of social determinants of health, how does that look? What do you think about as it relates to social determinants of health within your community? And so if we can open that up to a verbal discussion, that would be greatly appreciated. So when we think of social determinants of health, how is that reflected within your community?
Risk factors.
Okay, can you expound on what you mean by risk factors?
Those things that are putting specific groups at maybe a disadvantage than others. So social factors that affect different types of health and economic status in the community.
Okay, so those social factors that put others at a disadvantage or at
Yes.
greater risk.
Yes.
Wonderful. Anyone else?
Good morning, everybody. Hope everybody's doing well. So when I think about the social determinants of health and the categories, economic, education, health and healthcare, neighborhood and built environment, social and community context, then there are drop-down boxes in each of those that identify the specific areas where Black and Brown populations or high poverty, social vulnerability index communities experience disadvantages. And so that's what I think about. Thanks.
Wonderful, thank you. Anyone else? When we think of social determinants of health.
This is Deanna. I'm sorry. I do use some of them. I look at the map. I really like the old map that was available. I know it's a couple of years old, but I like to see what's the percentage of people who are paying more than 30% for rent, because I know that means they have limited access. They have limited resources because they're paying so much for rent. And in our area, it's really high. I look at transportation because that makes me think about, are they going to be able to get to a program if we have a parent program? So I do look at some of those in the hot spots, but I'll often overlay the maps because there could be multiple factors affecting one community.
Thank you, Deanna. Anyone else?
think when we're looking like in Wake County at the social determinants of health, one of the things that stands out, is looking at the economic stability, like Wake County is one of the most prosperous and booming counties in the whole state. Numerous jobs, very low unemployment. When you look at the county as a whole, so you think, wow, Wake County's doing great. But when you really look at it neighborhood by neighborhood, the majority of the county is doing great, but there are some neighborhoods who are struggling really, really hard. Like their stuff is like, they not having jobs available, not having transportations to get to jobs. And then because the housing, just the prices in housing have more than doubled in the last couple of years, and rent is going, people are being kicked out of their homes, they can't afford rent. And it's like certain neighborhoods where if you do neighborhood by neighborhood, we have several neighborhoods in crises, even though everything around them seems very prosperous.
Excellent. So it appears that, thank you, Virginia. It appears that our slides are up. I will give a caveat that since someone else is now leading the slides, that the Mentimeter slides may not work. So we may need to do an open discussion like we have thus far. So thank you all. Next slide, please.
Is this the right slide, Angela?
It is now. Yes, ma'am.
Do you
So
want me
you
to
can just go ahead and play that for us, just to make sure that we're all on the same page as it relates to social determinants of health. The audio has gone away.
I apologize. When I turned my mute on, I think it turned the audio
To
off.
provide for my kids, but no one is hiring. I don't know what to do.
I used to know every single person that lived on my block. Now I don't even recognize the place. There's just no sense of community anymore.
When we talk about how to maintain our mental and physical health, we often focus on things like eating healthy and going to the doctor. But our health isn't just affected by the choices we make, it's impacted by our environment. The conditions in which people are born, grow, work, play, learn, and worship are called social determinants of health. Social determinants of health can be visualized as a river with two categories of determinants: upstream factors and downstream factors. Upstream factors occur at the systemic level. Examples include institutional discrimination and accessibility of education, employment, housing, healthy foods, and quality healthcare. Downstream factors are specific to individuals. Examples include employment status, level of education, and aspects of identity such as gender, race, and disability status. Just as building a dam upstream impacts the flow of a river downstream, upstream social determinants directly affect downstream ones. Consider race. In and of itself, race does not impact health. Rather, systemic racism leads to consequences like less access to employment and education, which in turn negatively impact health. To begin to recognize the relationship between social factors and health, consider these statistics. Suicide rates are highest in the Western American states and in Appalachian regions. Non-Hispanic Black individuals have the shortest life expectancy of any racial group, and the mortality rate of Black infants is more than double that of white infants. And as compared to people with an annual family income of $100,000 or higher, people with a family income of $35,000 or lower are 5.4 times more likely to experience serious psychological distress. but 10.6 times more likely to go without needed care due to cost. Tackling the social determinants of health, especially the upstream factors, can seem like a huge task, but we can all make a difference by advocating for change in our own communities. A good place to start is with the U.S. Healthy People website. This site has stated goals related to social determinants, which are aimed at improving the following. 1. Access to jobs, food, and housing. 2. Access to education. 3. Community connectedness and inclusion. 4. Access to healthcare and health literacy. And 5. Neighborhood safety and housing quality. Throughout this process, remember that systemic issues impact individuals differently, that people are the experts of their own lives, and that social structures won't change overnight. But with empathy and sustained effort, we can better the health of everyone.
Next slide, please. So when we think about social determinants of health, as the video did so well, was to really frame the social determinants of health as an upstream issue. And so oftentimes when we look at the work that we do, particularly in the field of prevention, for the most part, we tend to stay at the individual, interpersonal, and even at some point, some of the community level. Social determinants of health work actually shifts our attention more towards community and societal level issues that really impact the lives of those that we serve. So as we move forward, and when Melinda begins to talk about social determinants as it relates to data sources that you all can access, when layering that data into your existing needs assessments, it's important to consider data to inform your actions, but also try to move as far upstream, because as the video stated, this can be a little overwhelming to think about how do we shift systems level systems in order to impact individuals. And so just think about how far you can move upstream towards those factors that are most modifiable. And how it connects to the work that you do. So we're not asking you all to go in and flip school systems and things of that nature, but literally move as far upstream as you can towards, even as it stated in the video, probably advocating for change and things of that nature as you're looking at doing the work that you're doing. Next slide, please. Okay, so another question as it relates to Mentimeter, which is not functioning within the slides, is what are your concerns? Actually, let me put it this way. How confident are you in collecting social determinants of health data in your community? And you can actually put this in the chat box on a scale of 0 to 10, with 0 being not at all confident and 10 being extremely confident. How confident are you in collecting social determinants of health data in your community?
Well, I was going to answer both your questions. So in terms of confidence level, feels pretty high. Having said that, what concerns I have is that collecting this type of data could be kind of inherently shaming. And so I think needs to be collected in a very sort of gentle and empathetic way as to not increase shame of individuals from diverse backgrounds.
Wonderful, thank you. And I can barely see you, but thank you. I think you brought up a very good point, which is, being mindful of how we collect the data, because it can be shaming in some way. So thank you for sharing that perspective. I see that a lot of individuals are falling between 7 and 8, being quite confident in your ability. I think we have a 9 in there as well, being quite confident in how you actually, your confidence in collecting this data in your community. And at this time, I'll turn it over to Melinda to lead us further. Are there other comments?
Yeah, I think it really depends on which things how deep you're trying to go and what kind of tools you're using. And that is my concern with some of the ACEs collection stuff. It's almost as if you just collect all this really, really traumatic information and then people just kind of get paralyzed and then you've you've just kind of like picked at a scab and done nothing to repair the damage, that you see. So I think that makes a difference is how we work together to get tools that don't traumatize people while we're trying to collect information.
Absolutely. I think you also highlighted another good point, which is collecting a lot of data. You're collecting a lot of data, you're ripping the scab off per se, as you just mentioned, and being paralyzed to address it. I think part of it is also being very intentional about the data that you do collect and that it's moving you towards action, right? So not collecting data just for the sake of collecting data, because it can be a little overwhelming. It can be re-traumatizing if you reveal some things and then you're unable to address those things that you reveal. So being very intentional about how you're collecting that data is important. And Melinda, you may want to add to that as well.
I would say I agree with that. There are, of course, lots of complexities, and I actually rated my ability to do this lower than a lot of you in it, and it's for those various kinds of concerns about those sensitivities, as well as just practical abilities to go as deep as we might want to go. But that said, there are quite a few places that we can at least go to preliminarily get our social determinants of health data. As many of you know, by your various confidence levels, we can tell that we have people on this lens who have been working on collecting social determinants of health data, as well as likely some ACEs data. There's various frameworks for doing it, but one of those frameworks is lists social determinants of health into 5 domains, including economic stability, education access and quality, healthcare access and quality, the neighborhood and built environment, as well as the social and community context. And on the next slides, I'm going to share some potential measures that are usually available through some sort of online source that we could get but that we could also get updated data in our communities. In terms of economic stability, we can look at various measures of employment, both unemployment in general, as well as unemployment, particularly for parents. Also, we can look at teens who are not either in school or working, or who are not in school and also not graduated. The proportion of families that are spending more than 30% of their income on housing, various measures of poverty, children eligible for free and reduced price lunch. Most all of these data can be found on the Kids Count data, which for some measures have breakdowns that look at these measures by different population groups. There are also usually things that we can get in our communities. And there are things that we might want to ask about if we're targeting, in particular, some of our youth educational outcomes, our social emotional outcomes for youth, as well as parents. There are a variety of other indicators as well, and that could be looked at and that you might have better access to in your communities. As people have mentioned, a few people gave different scores depending on the location. Some things are easier to get in one community than another. And so the website on the prior slide, which you guys will also get in a handout, does have links to lots of different measures as well as where you can get those. But in general, the sources that I've most heavily referenced are the Kids Count data source, the Robert Wood Johnson County Ranks and Roadmaps, and the North Carolina School Report Cards. The second domain is education access and quality data. This, as would not be surprising for any of you, is things that heavily rely upon North Carolina School Report Cards. If any of you have looked at those recently, there is not detailed data for the 2020 reports, but there is if you go back into the 2019 reports. And I'm sure at some point in the upcoming months, we will have updated 2021 report cards. But some of the things that are potentially useful to look at are your proficiencies in reading and math skills, which can be broken out by school level. So if you're doing elementary intervention, particularly tutoring kind of intervention or mentoring intervention, you might want to see if you where you're at in terms of proficiency with grade level skills, and that can be broken out by race and ethnicity, as well as economic and gender. You could also look at chronic absenteeism, which of course was a significant problem throughout the pandemic. And we might want to be tracking that and seeing if it's differentially impacting certain populations. That at the North Carolina School Report Cards is not broken down by any demographics, but that's something that you might be able to get from your school system broken down. Then it could be helpful, particularly if you're looking at a preschool or early elementary intervention, to be looking for information on children who are developmentally ready for school or who participated in high quality early education programs. I could not find measures for these online. So if anybody knows of sources where you could begin to investigate this in your communities online, it would be great if we shared those in the chat. They are things that you can likely find out in your communities. All kindergartners do kindergarten readiness assessments. And so that's potentially something that could be looked at. There are also measures of high school students who graduate within 4 years versus longer, as well as measures that look at what proportion of high school students are immediately enter college, as well as other indicators that are looking for people who have not graduated from high school by the end of early adulthood. Most of those measures for education access are going to be heavily on school report cards, but there's also data in Kids Count. If you guys haven't looked at Kids Count, they do have lots of different indicators. Some of them have demographic breakdowns if you go deeper, and some do not. But you can often have a sense of whether you could get that deeper breakdown in your community by just knowing what's collected and how it's collected. The third domain is healthcare access and quality data. So there's lots of potential measures that you might consider looking at here. You might look at enrollment in health choice or Medicaid services, how many youth as well as adults who are not Medicare eligible, who do not have insurance. Of course, in our state where we have not expanded Medicaid, there is definitely a gap, and it is largely disproportionate. That can be looked at on the Robert Wood Johnson County Ranks and Roadmaps. It might be also be worth looking at your healthcare access. So both primary care prevention, mental health, you might look at substance abuse treatment. Some of those measures are on the county health ranks and roadmaps. It's also useful to find out how many of the people who have a substance use disorder have gotten treatment in the past year. Again, this is one where I did not find an online source, but I think you could find information about capacity, looking at how many people your LME MCO is serving, as well as the capacity of treatment agencies in your communities. So if anybody knows a online data source for others to be able to share, I would love it if we shared that. And then the last domain is social and community context data. There's lots of potential areas that could be looked in this, and most relevant for us, I thought were indicators of child abuse and neglect, children in foster home, children in foster care due to parental substance misuse. As many of you know who've been doing substance use prevention for a long time, the vast majority of foster care placements in most communities are due to substance misuse. That data is available at Kids Count, but you may be able to get more information through your local agencies. We might also want to know more about residential segregation and income inequality, which we can get in the Robert Wood Johnson County Health Ranks, as well as we know throughout the pandemic and of course prior and now there has been a rise in incidence of food insecurity and access to healthy foods, which we can get as a first step through the county health rankings, but we might be able to get more detailed information from our local resources.
Melinda, can you possibly go back? I don't know if you covered the one on neighborhood and built environment data.
Oh, yes, I think you're correct. I don't know how I skipped that one.
Just want to make sure we get that one covered as well.
Yeah. This, of course, has lots of things that are important for prevention when we're looking at our neighborhoods and built environments. Some of the measures that we could include are indicators from our North Carolina school report cards, which would have suspension and expulsion data. It would have counts of criminal acts, bullying, harassment, referrals to law enforcement and arrest. There is also at the Department of Public Health, the 9 reportable offenses, which includes substance use offenses, as well as violence-related offenses and such. Through our county health rankings and roadmaps, we can get data on the number of violent crimes in our communities, alcohol impaired driving, homicide, suicide, firearm fatalities, and juvenile arrests. So additional violent indicators. We can go to our local helping agencies to see if we can get any more up-to-date and demographic breakdowns of those data or neighborhood breakdowns of those data. And of course, we've all been in prevention for a long time. We know overdose has been a problem. The North Carolina Division of Public Health Injury Branch does extensive data collection on overdose surveillance, and they have things both on their website that are continually there that show overdoses by different substances, as well as emergency department visits, hospitalizations, and death rates. They also have monthly reports that they send out, which do a lot more breakdowns than what you can get on the main surveillance pages. So those might be worth exploring to find out more about disparities in overdose. And it might be worth getting on their distribution list. And then, of course, in terms of prevention, it's probably worth looking at what kind of tobacco policies parks, schools, and other work sites have. And I did not find, again, I did not find a online source for that. That's something that is often done through environmental scans. And again, with each of these categories, if you go to the Healthy People website, it has many additional measures. So these are highlight ones that were mostly accessible or very clearly relevant for substance abuse prevention work.
Thank you, Melinda. So the next minty question, we're going to actually skip because we sort of touched on that during the last discussion, which were, what are your concerns with collecting social determinants of health data in your community? I see that some of you are still responding in the actual app, and I can see it on my version of the PowerPoint here. So something that really was not brought up during the previous conversation was a lack of standardization in data collection and sharing, which is a concern. Finding a valid data source and building trust within the community with some of the other concerns that were highlighted from those of you who entered it directly into the Mentimeter website. Next slide, please. Yes.
Oh, I was just gonna add on to that, the Healthy People Health Disparities site, it does always list a data source for things, but there are some that are less standardized where they have a description of it, but not necessarily show access to it. Those are worth looking at to think about where you might be able to get it in your community if it seems like a potentially important indicator. But I did not include those unless I could find it somewhere online for beginning assessment steps.
Thank you. So the next slide, I'm gonna, if it's okay with the team, I am going to move the sharing time to after we cover the ACEs, and what we can do is have a collective conversation around social determinants of health as well as ACEs, just to make sure we get through all of the content. Next slide, please. But as we are going through this and looking at the data points that Melinda has highlighted, I mean, it is important for you all to consider, you know, what is it that you currently know about the target populations that you're trying to serve, your communities, as it relates to social determinants of health and ACEs, and then what is it that you want to know as it relates to social determinants of health and ACEs, and then where can you get that information? And so you can go to the next slide, please. If we can start the video, thank you.
Hi, this is my neighborhood. I grew up in this building. This is a great community now, but it's had its share of problems. When I was a kid, our community had high unemployment, a lack of resources for families, and lots of kids hanging out with no adult supervision. You might have heard about adverse childhood experiences, or ACEs. ACEs are traumatic events in childhood, like abuse and neglect, that can increase risk for future problems. But they don't have to. The good news is that ACEs and their consequences can be prevented. Take me, for example. I was at risk for ACEs, and despite all the things that put me at risk, some pretty incredible people helped make sure that I wouldn't become another statistic. Come on, I'll show you around. That's Jackson. He's a cool kid. His dad left when he was 2, and his mom works 2 jobs. I hang out with him every Thursday night and help him with his homework. Sometimes we grab ice cream. It's fun. Plus, he has another adult role model to learn from and trust. That's Mr. Martino. When I was a kid, he let me help him at the store sometimes after school when my parents were working late. He did that for a bunch of us. My dad actually found his job as a mechanic because of Mr. Martino. This helped our family in so many ways. Not only did my dad have a steady paycheck, which eased his stress about paying rent and buying necessities like food and clothes, but he was also a lot nicer to me, my brother, and my mom once he started working a job that made him feel good about himself. When communities come together, they can do so much to prevent ACEs. Mr. Martino and other local business owners put together a series of career workshops to help people like my dad find work. My mom also got a job with a company that allowed her to work from home and spend more time with me and my brother. Mariana has just gotten out of a class about handling challenges of single parenting. The clinic offers free childcare so Mariana's daughter, Ella, can play while Mariana's in class. The class helps parents like Mariana develop positive parenting skills, not just for babies and toddlers, but for teenagers too. This is another way our community has come together to give families the resources they need. And just one more way to prevent ACEs. This was my school, Riverside Middle, right in the heart of town. These kids are here for a sponsored summer camp. This community-supported program helps families with affordable, quality childcare and helps kids get tutoring and learn life skills. When I was a kid, I spent a lot of time at this school all year long. There was one counselor, Miss Greer, who I remember more than anyone. She was a really good listener. Miss Greer helped me and my brother get involved in after-school activities like baseball and soccer. Our coaches were super nice and were mentors to us. Staying after school for practice kept us and a lot of other kids out of trouble. When schools help take responsibility for preventing ACEs, everybody wins. My life could have gone in a completely different direction. Studies show that ACEs can have long-term negative effects on kids' health and well-being that may last into adulthood and even continue in future generations. But by people and groups taking action, ACEs can be prevented. In fact, there are 5 known strategies that help stop ACEs before they even start. You can implement them in your own community, just like we did. How? By strengthening economic support for families. By changing social norms to support parents in positive parenting. By providing quality care and education early in life. By enhancing parenting skills to promote healthy child development. And by intervening to lessen harms and prevent future risk. So, now you know my story, and you've seen the prevention strategies in my community that helped me beat the odds. I had healthy relationships with my family and friends. I learned how to take care of myself and make good choices. And today, I'm a mentor to other kids who need some extra help so they don't become an ACEs statistic. Safe, stable, and nurturing relationships and environments are essential to prevent child abuse and neglect and to assure that all kids reach their full potential. Are you thinking what I'm thinking? Banana split? You got it.
Next slide, please. And Latasha, I did see your comment just pop up about the lack of local data. And hopefully when we get into the sharing time, we can talk through that a little bit more. But as the video just quickly highlighted that, you know, as a reminder, ACEs are potentially traumatic experiences that occur in childhood that can impact children for years throughout the course of their life. And so hopefully a part of the work that we're doing, addressing substance use, substance misuse, and stressors related to COVID-19, some way we'll be able to intertwine addressing some of the ACEs within our programs. And we'll talk a little bit more as we move forward. Next slide, please. And so when we think about ACEs, they are divided into 3 categories. I'm not going to get into the subcategories because Melinda's going to talk that through in her next slides. But they're abuse, household challenges, and neglect. And so when we think about the work that we're doing, hopefully some of our strategies will be able to have some level of impact in these 3 categories. And I'm going to turn it over to Melinda. After we skip the next slide, because that is a Mentimeter slide, Melinda will transition us into talking about the data sources available related to ACEs.
When we look at ACEs, are, of course, they're very specific. They're looking at, first of all, potential abuses broken out into emotional, physical, and sexual abuse. These are data that do not necessarily have a specific online source where you can go to get them, but they're things that you can potentially get in different ways in your communities. So of course, with emotional abuse and physical abuse and sexual abuse, one place to begin to look for that would be within your child protective services and social service agencies that are responsible, of course, for investigating and responding to those abuses. You may also be able to look to your law enforcement for some, as well as your domestic violence shelters. Household challenges are the largest category for ACEs. They include the mother being treated violently, substance abuse in the household, mental illness in the household, parental separation or divorce, and incarceration of a household member. Some of these you can get in larger regional areas for your local data, but many, again, are not available in an online group format. So again, identified some places where you can ask about this kind of data, such as, again, law enforcement agencies, domestic violence shelters, social services. The county health ranks and roadmaps do have information about mental illness in the household. The National Household Survey on Drug Abuse sometimes publishes regional information on substance misuse as well as mental illness. They tend to be fairly far spaced out at aggregate of 5 to 10 years. So that might not be the most up-to-date information for changes in your community. And so it may be most effective to go to your various local helping resources for these. And then the last category of ACEs data are around neglect, both emotional and physical neglect. And the easiest place to go for these data preliminarily is to look for your social services and specifically child protective services to find out about their cases.
Okay, thank you, Melinda. And so overall, again, so on the handouts that you all received earlier, your columns are divided into these three categories. Basically, what do we know? What do we need to know? And where can we get that information? One thing that I just want to bring to everyone's attention as it relates to completing your needs assessment. Most of you all did a really good job of identifying social determinants of health data, being able to identify how COVID has impacted your overall community. I know some of the data points which has come through in the chat and through some of the discussion, it's difficult to glean that information at a local level. So you all did a really good job of pulling in regional, state, and national data sources to highlight the impact of COVID on your communities. And from there, you were able to identify target populations and then the strategies that you all are proposing to implement. One part of this needs assessment process is that we're really asking you all to dig deep as possible to identify social determinants of health and or ACEs data that is specific to your target population. And I'll just do a random example. So instead of just saying that COVID-19 made it difficult for students to go to school in my community, and we're going to serve elementary school kids doing Too Good for Drugs, we want to be able to see specifically what is it about COVID, social determinants of health, and or ACEs that really directly impacted the performance of your target population, and why Too Good for Drugs is the best strategy to address that specific issue. And so as you're going through this process and going back and looking at the data sources that Melinda has identified for us, and even others, I think I've seen in the chat that Smart Start is a source that can be considered as well, really honing in and saying, from a county perspective, we know that there has been academic failure among the students in our community, particularly elementary school kids, and it's due to lack of attendance in school, due to either high suspension rates or lack of remote access to learning. And as a result, they're unable to meet the grade level benchmarks. And so our strategy is going to be tutoring programs, which is allowed under the COVID-19 program. So we're doing tutoring. So if you see how all of that shakes out, and then being able to identify, you know, if you're going to do the academic one, if you have access to school records that says that, you know, a certain percentage of our elementary school kids were retained due to these issues. So what do we know? Students are being, that they're failing, they're being retained. What do we need to know is more information around suspension rates, more information around attendance or lack of attendance due to remote learning. And then where can we get that information? Could be our school partners. So being very intentional around that part of how you actually access that. So if someone wants to step out there, if you want to take a few seconds to think that through, looking at one of your target populations, looking at what you currently know about them and what it is that you need to know about them. If you all are willing to share some of that information, what do you need to know as it relates to social determinants of health? What do you need to know as it relates to ACEs? And then where do you think you can get that information? And you can also put that in the chat if you're not wanting to vocalize. Okay. Again, I'm reading your question now. So, so the question is, and this is for the overall team, could we talk more about how we integrate with groups already working on these issues? So we don't try to duplicate efforts. Excellent point. In other words, if we are aware another group is working on a specific factor, is implementing something to address, we can note this and why it is not an issue we need to address. Okay. So the question is, how can we integrate with groups that exist already providing the services so we can avoid duplication? And then the other one is, can you just make a note that this is already being done so you don't have to address it? So I would, for the latter piece, my gut response would be yes, it's very important to be able to identify what partners are doing. If they're already addressing that issue, I think it's important to note that they're doing it, and then there's no need for you to do it, but also go beyond that, particularly in your final needs assessment draft that you're going to have to submit. Talk about how their work benefits the populations that you're serving, right? So it's not just enough to say, well, the school system is addressing high suspension rates among, let's say, Black and Hispanic students, and that's one of the issues that you're trying to address. Also talk about how that will then ultimately impact the population or the students that you're serving, if that makes sense. And then my other piece of guidance or suggestions would be, again, the rest of the team can chime in. If there's a group that's already doing the work, you know, we understand that community-based process work is also important. So identifying ways to partner with them in their work. We're not asking you all to duplicate, to create systems that are already in place. It may be a matter of just identifying opportunities to partner. I think one of the videos talked about, advocating on behalf of certain issues in your community. And that may mean becoming a partner within those existing groups, particularly if they have coalition meetings, task force committees, and things of that nature. I'm going back to the education, example. When we talk about high suspension rates, there are some school systems that have, a task force on disproportionate contact, minority contact when it comes to suspensions. And so looking to see if you can become a part of those committees or those task force looking at disproportionate minority contact as it relates to school suspensions, may be a way of doing that work as well. But ultimately, we want to be able to see a clear linkage between the data, your population, and the strategies that you're choosing. Does anyone else have any input they would like to share from the team? Felicia, Jessica, Melinda, Amanda?
Well, we have no input from here.
Okay. Okay, I'm going to turn it over to Felicia, and she's going to talk about sort of what we just talked about just now, partnerships.
Thank you. All right, so what I want to do in this little piece is look at the importance of building the relationships with the partners, coalitions, and collaboratives to collect your data. And you can just put your answers in the chat for me, but why is it important that we do that? Why do we need those partnerships? Why do we need the coalitions to be involved in our efforts of collecting this data? Anybody here? I see you thinking. Y'all, this is my sister with blonde hair. Got it here. Okay, see a couple comments coming in. I'm not actually sitting at the table. Mandy, can you read those for me?
Yes, I was getting ready to say, Deanna put more access to more resources, building capacity, build sustainability, to grow the understanding of the impacts. They can have access to data you might not know about. These are great answers and responses.
Any responses from you?
They're wonderful answers as well. And I would just highlight and lift up the fact that over this past year, I'm sure many of you as prevention providers have found yourself partnering with organizations that you would not have traditionally partnered with. So I would say continue that mindset as you're looking at identifying data within your communities. I know, many of you did work with realtors, work with food programs, and things of that nature, just making sure that you identify those partners that you wouldn't normally partner with as you begin to try to identify and uplift additional data around social determinants of health and ACEs.
When you think about it, social determinants of health, ACEs, all of that's pretty new when we want you to think of it as something that's it's always been there, but this is going to be new data that you're collecting and adding to what you already have. So we're just hoping to make it a little bit stronger. A lot of the funds are now centered around that. So we want to make sure that you have everything you need in place when that time comes for you to maybe continue your programming. And they ask for you to have that connected to social determinants of health assessment piece, you already have it. So it does do all of that. Everything that you all mentioned in the comments as far as creating that ownership, the buy-in to your efforts, all of that's very important. And when you think about it, this is a huge undertaking. Okay, collecting data is just something you can't do overnight. Many of us have probably gotten the data passed down from year to year, and every time there's a grant come up, you say, oh, let's pull it from this past application we submitted. Oh, we did that. We can do that. We can put it back in here. Let's take that piece out. So what we're asking you to do now is look at other sources, look at other partners that you can pull in to help you get that data. As you notice, when Melinda and Dr. Maxwell, they were talking about the different sources, the indicators, there were some places that were missing. And I don't know if you put it in the chat, but did you all think about where you could get those indicators? What sources were you able to tap into in your own communities? That's going to be very important to think about when you're collecting this data, and you can't do it by yourself. You're going to need someone else to help you with that. Do you have any other comments? Okay. Next slide. Please.
So then what are the next steps? So you have your initial handout that is really guiding you all through this process of really thinking about specifically what is the primary issue that you're addressing within your community, what are the root causes, the intervening variables, and specifically the target population. We are asking that you identify at least one social determinants of health factor that you will identify 2 to 3 data points around for your target population. You can then layer on top of that an ACEs specific data point, or you can indicate that it's not applicable because we understand that some of the ACEs may not necessarily apply to your the issue that you identify within your community or the target population that you're working with. So at minimum, at least one social determinants of health factor as it relates to your identified problem as well as your target population. So the next step from there, you all will receive after today's training, the final needs assessment form. If you can go to the next slide, please. So you can see what that will look like. Again, once you go through the exercise of, again, identifying your problem, the root cause, intervening variable, and the target population, and then selecting your social determinants of health, part 1 is that you will bullet point your 2 to 3 data points for each. And then in part 2, we're asking you to then put that in narrative form. Really helping us paint a picture for us how social determinants of health is influencing or impacting the populations that you're serving, as well as ACEs. And then following up and answering the question based on what you've learned through this process, whether or not your selected strategies needs to be enhanced or revised. And so, again, once you go through this process, paint the picture for us and then answer whether or not your strategies need to be enhanced or revised. And all of this work is due by December the 17th, uploaded into your ECHO briefcase. And I know that for some of our newer block grant providers, you're getting your account set up. I expect that you should be in position to do that by December the 17th. And so those are the next step. The next thing, well, even before December the 17th, one thing to put in your calendar is your needs assessment will help support you developing your final work plan, which is due in January. And there will be a brief teaching session on completing your logic model and your work plan on December the 1st at 11 a.m. Okay, and as we said early on in this process, there are going to be a lot of meetings, a lot of trainings and workshops. Once we get past this December hurdle, you all should be smooth sailing to getting your work completed. But again, December the 1st is the logic model and work plan development training session, and that will begin at 11 a.m. You all will receive a link for that session.
Angela, I had a couple questions that came through in regards to accessing handouts and slides and recording. And so I know that we have some of you guys participating today that are not COVID recipients. And so you will have access to the slides and the recording within Whova. And then these required documents for our COVID grantees, you guys will receive that directly from Felicia. So I had a couple direct questions about that I wanted to clarify for everyone.
Wonderful. Thank you so much, Amanda. And so I think this is our last slide. If you can go to the next, does anyone have any questions beyond the ones that have been presented? If not, Felicia, would you, or Jessica, would you all like to do a wrap up for us today? Thank you, Latasha.
Thank you all for attending. Was there one last slide or that's the last one?
This is the last slide.
Okay. All right. So thank you for attending. And again, all of the handouts, we're going to put those on Google for those who are non-COVID providers. And for the COVID providers, I will be sending you an email sometime as soon as I can get back home and get to a computer. I'll be sending you out all of the links, the handouts, and everything that you'll need to continue with the work. And I look forward to talking with you all next month because it's already November. So I can say next month now in December. So that's it for me. Any last words from you all? Jessica, Amanda, Dr. Maxwell, Dr. Pancratz?
Thank you all for sharing your time this morning.
Yes. Yes,
Thank you, everybody. It's good to see everybody.
guys.